I want to now introduce Mr. Matt Hanna of Merck Animal Health, and Matt will give a welcome and an introduction.
Thanks, Dr. Epperson. I'd like to take just a minute to thank you and Harold Newcomb. Whether this is live in person or virtual like it is this year, this is a tremendous undertaking of countless hours and hard work. There's so much that goes in behind the scenes to make this truly a best-in-class, awesome meeting. It's always very informative and entertaining, and you make it look easy. I think I speak for every veterinarian, customer, and Merck employee online this evening and for the next 4 evenings. Thank you. We really appreciate everything both of you have done. Now I'd like to introduce Charles Durbin. Charles is gonna welcome everybody. Charles is the Director of Cattle Sales for the eastern half of the country. So Charles, I'm gonna turn it over to you.
Well, thank you, Matt. I really appreciate that. As Matt mentioned, my name's Charles Durbin. I live here in Fort Worth, Texas, and I work with Matt and several other individuals on this call at Merck Animal Health. As Matt stated, I really appreciate the opportunity to quickly express my thanks to Dr. Epperson, the Mississippi State crew, and the Merck crew that's been involved in putting this meeting together, and quite frankly, supporting this huge transfer of knowledge. I'm told that this is the 6th annual event. Congratulations for that. And with that, the first one that's been virtual. So, as we have adapted to these trying times, we've all had to explore new ways of working and getting things done. Merck Animal Health is proud to be associated with this great meeting, and I know that it will be as successful as years past. With that, I think I'll turn it back over to Dr. Epperson, and good luck.
Okay, well, thank you. I think we're going to need a little good luck, but we do appreciate the sponsorship that Merck Animal Health gives to this program in bringing the speakers to us and in providing the funding for the continuing education. And speaking of continuing education, if you want to receive continuing education credit for these nights, and there'll be 4 continuing education credits each night, so there's 4 hours roughly of presentations, you can get that. Okay, and how you will get that is you will have to take a test of the material that is presented each night, and you will need to get 70% on that test. So think back to school now. The test will be about 20 questions long, and it will cover the entire night's topics. So tonight's topics, Jason Nickell has 2, and Dan Thompson has 2. The test will be 20 questions over about 5 the first presentation Jason does, 5 the second of Jason, 5 the first of Dan, and 5 the second of Dan. That's what you should expect. The link to the test, this is an online test, so you take it online. The link to the test you will receive in an email that I will send at the end of this meeting. So you check your email box, and you will find a link that will take you to a Qualtronics survey test that's hosted at Kansas State. You take the test, and Kansas State will send you the CE certificate by email. You can take the test repeatedly, so that's a good thing. Now importantly, Dr. Newcomb will do a test review at the end of the night in the summary and key points time. That review, I would say, is very, 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 very helpful in passing the test quickly. So I would say we should be watching these presentations, taking notes. We need to watch Harold's review, check your email for the link to the test, and take the test. And then, as I said, KSU will send the certificates to you at the email address you provided. Okay, so that's a little bit about that, and I am going to turn it over to Harold Newcomb for a welcome as I get ready to run the first video.
Thanks, Bill. I just want to welcome everybody on behalf of Merck Animal Health. I want to take just a moment to thank you, Bill, and especially Ronnie Abel, because Ronnie handled most of all the invitation stuff. I also want to say thank you to all our speakers. And I'd like to say thank you to our tech service people that are on here and that have helped support this meeting. Without you, it wouldn't be possible. Our presenters, most of our presenters are related in so much way or another to Merck Animal Health. And I want to thank them for taking their time to put these presentations together and do this. I would also like to ask everybody's patience with this. As Bill said earlier, we are not necessarily IT gurus, and we're hoping and praying there are no glitches, but please bear with us if they are. So with that, Bill, I say we get started.
Okay, we're going to get started. You want to go ahead and introduce the first presentation, Harold?
Sure. Our first presenter tonight is Dr. Jason Nickell. Dr. Nickell, he is with our Allflex Intelligence Livestock Group, and he lives in Missouri, and actually he is the manager of livestock professional services for Allflex Intelligence. Jason, with that, I'll let you go ahead.
Okay, thank you, Harold. We'll get started.
Harold Dr. Newcomb asked me to speak to you over the next couple of hours regarding two different topics that we are working on within the intelligence space. That being circling in this area of BRD prediction, that will focus in on the whisper on arrival technology, but then also moving on from there within the realm of BRD detection. And within that, we will be discussing the recently acquired quantified ag technology. But with that, we'll move right on into the whisper on arrival technology. The whisper on arrival is centered upon the concept of BRD prediction. And I think we can all agree all the factors that have been associated with elevating a calf's risk of developing bovine respiratory disease. Okay, we know from prior, my pointer here, we know from prior research that weaning practices or lack thereof contribute to risk. We know that commingling with other groups, is associated with risk, as is weather, distance traveled, and moving into a high concentrated diet. All those parameters are associated with elevating an animal's risk of developing bovine respiratory disease, right? And so the obvious next question is how can we get a jump on that, right? Well, and as an industry, we have tried a number of things, right? We have tried in the past to predict this, and we still do this today, right? Whenever we have an incoming lot of animals, and based upon perceived and or known risk factors, we assign a risk classification to an incoming lot, whether that be high, medium, or low, correct? And in most cases, those high risk cattle are going to be administered metaphylaxis. Medium risk cattle, and it may depend. In many cases, we may give BRD metaphylaxis. In some cases, depending upon the situation, we may decide not to. And in most low risk situations, the decision is usually not to administer metaphylaxis. But the reality is the work that's been done in the past to actually try and quantify whether or not we can accurately predict BRD risk, perceived assessment an incoming group of animals. That work was done in the last 10 years at Kansas State University. And really, at the end of the day, what those authors observed was the ability to predict the risk classification, accurately predict the risk based on perceived risk factors is about 50%. So you just as well flip a coin as to what their actual true risk is going to be. A lot of variation, as you can imagine, body weight, time of year. But at the end of the day, we have limited accuracy in being able to assign risk and show an assignment of risk and being able to predict that risk downstream. And so as an industry, we've tried multiple things, right? Temp and treat is one potential management practice that you all may have used in the past or have customers that use currently. And so there has been a little bit of work done, admittedly not a lot, but a little bit of work done in that space where, basically the concept of temp and treat is only to administer metaphylactic antibiotics, or perhaps in this term therapeutic antibiotics, to animals that are above a certain threshold. Okay, say in this case 104 degrees. Okay, anything less than that would not receive antibiotics. What the authors found in this study was that fever-based treatment was less effective than metaphylactic treatment for decreasing the prevalence of BRD in new erratic cattle. Okay, so what does that tell us? Is that rectal temperature in and of by itself is not predictive of the downstream BRD incidence. Okay. And so we struggle with that. And so the one management practice that we have leaned on time and time again, and that we have the better part of 4 to 5 decades of data to support, is that of metaphylaxis. Okay, this management practice works. And as a BRD control tool, this is one of the few tools that we have that we can replicate over and over again and show efficacy with this management practice. We currently apply metaphylaxis, as you're aware, to the entire lot, again, because we can't predict which lots, we can't predict which lots needed or which animals within the lots needed. And so if we decide to administer metaphylaxis, everybody in that lot gets it, right? The question has always been, among researchers, among veterinarians, is that does every animal in that lot need metaphylactic antibiotics? And we understand what is going on here. We understand we're changing the disease dynamics, even among those healthy animals or perceived healthy animals. But at the end of the day, does every animal in there need that? In the last 3 to 4 years now, some data was generated out of Kansas State University, once again, that looked at roughly 25 BRD control studies that utilized the negative control. And at the end of the day, what those authors observed was that in order to mitigate one case of bovine respiratory disease, we have to administer BRD control drugs to 5 animals. Okay. Now, this is on average. This is not in every lot. This is not every day. This is on average over a period of time. On average, we have to administer BRD metaphylaxis to 5 animals in order to reduce one case. Okay. And so what that, one interpretation of that data is that on average, we are over-administering antibiotics. And so Whisper on Arrival, this technology was designed to predict which animals in a cohort need antibiotic therapy and who do not. It was designed, therefore, to reduce the cost or the investment of that BRD metaphylaxis program to the producer. But at the same time, for our profession, it was used. It's there as an objective means to support judicious antimicrobial use, as well as maintaining the positive attributes of BRD control. But at the end of the day, if we are not, we can reduce antibiotics all we want, but if we're getting a worse result than what is done conventionally, we're missing the mark. And so at the end of the day, we want to be at least as good as conventional metaphylaxis in order to justify the investment in the technology and reducing the input costs of the metaphylactic drugs. And so whisper on arrival revolves around the utilization of 4 pieces of information. That is lung sounds, heart sounds, rectal temperature, and body weight. Okay? And it utilizes all 4 of those parameters, utilizing machine learning capabilities in order to provide a treat or a do not treat outcome for the user. And so over the last 2 years, we have generated a large amount of data. And just to forewarn you, I'm going to present to you a large amount of data, but I will walk through it. We'll walk through it rather slowly. And I can imagine you're not going to grasp all of it in this relatively short amount of time, but we are going to hit the high points here. But the overall objective of this study was to determine if cattle health and performance comparing a targeted BRD control program based on individualized risk prediction was superior to a negative control, which was no metaphylaxis, yet no different than a positive control. And the positive control in this case being conventional BRD metaphylaxis or administering metaphylaxis to 100% of that population. Okay. Across the board, our sample population, we wanted animals that were of, typical feeder calf status, purebred, crossbred beef steers. These animals were considered to be, by the study site, and based upon the history of buying through those channels, considered to be at anywhere from medium to high risk. Okay, so populations that they would, in normal circumstances, administer to. Body weight obviously was at arrival was relative to their age. We had 4 study sites, so we ran the same study protocol at each of 4 sites. Now the 4 sites differed to some degree, and we'll get into that a bit. But we had 4 study sites, 2 in Texas, okay, 1 in Oklahoma, and 1 in Nebraska. Enrollment criteria was relatively loose. Again, these populations had to be identified as requiring metaphylaxis. So again, in a normal day-to-day activity, these incoming lots would be considered at medium to high risk and would have been administered metaphylaxis regardless if they were part of the study or not. But also, they also had to have no clinical signs of severe BRD or any other non-BRD syndromes that would have reduced the likelihood that they would have made it to the end of the study. On day 0, which was the day of processing, every animal in those enrollment groups received a modified live viral vaccine with a manhemia and that included manhemia and pastorella, a 7-way blackleg vaccine. They were dewormed. They were implanted. We administered an individual ID tag to each of those animals. We grabbed an individual body weight, and we either did or did not administer metaphylaxis. And I will describe that here. And what I mean by that is that in addition to receiving all of these processing products, we randomly allocated animals to one of 4 treatment groups. Okay, a negative control, which received saline, a positive control, which received Zuprevo, 100% in that group, a whisper high group, where Zuprevo was administered when the probability of developing BRD exceeded that threshold, and in the whisper low group, where Zuprevo was only administered to animals that exceeded that particular threshold. We're going to talk about what whisper high and whisper low means here momentarily. All of these animals were pinned by treatment group. So 10 was the experimental unit. And the pin numbers and the numbers per pin varied by site. And we'll talk about that momentarily as well. Now, I want to touch real quickly on give us some background on the whisper on arrival algorithm thresholds. Without divulging anything proprietary, I'm going to give you a high level overview as far as what was being done. And so ultimately, at the end of the day, the algorithm is generating a predicted probability that an individual animal is going to develop bovine respiratory disease. Okay, it's a number. Okay, it's a continuous under a continuous distribution. All right. And so, as an example, what you see here on the screen is is just a fictitious distribution of the probability of developing bovine respiratory disease in a population. Okay, I've purposely make it appear to be normal. I can tell you right now, it's not a normal population, at least in the populations that we studied. But for the sake of this exercise, we're going to assume it's normal. For the purists in the room, I want to confess that you're seeing a bar graph. We know this should not be a bar graph. This is not the right way to graph continuous data. It should be a line graph. But I'm not good enough with Microsoft Excel to make that work. So we're going with a bar graph here. But nonetheless, it will get us through what we need to discuss. And so if we assume that this is our distribution, the x-axis being the probability of developing bovine respiratory disease, the y-axis being the count, the number of animals in each of those probability buckets, if you will. Then we, based upon prior work leading up to this series of studies, we set two different thresholds. Okay, the first one was this whisper high threshold. Okay, so we drew a line in the sand at one particular point within this distribution, and we said everything to the right of that, so everything that was above that threshold that had a higher probability of developing bovine respiratory disease was to receive metaphylactic antibiotics. Okay, everything below that would not. All right. And so what the user sees, again, and we'll talk about this more here in a few moments, is that they see on the screen treat or do not treat. They don't know what the probability is. They just see treat or do not treat. But this is what's going on in the background. Okay. Same thing and so whisper high represents a fairly conservative threshold where, although it's less than the positive control, we're still treating a lot of animals. So for those folks in the background or any of you that may be interested in diagnostic testing, really what this represents is a threshold with a relatively low sensitivity but high specificity. So, the other way around, high sensitivity, low specificity. So we elevated our number of false positives. So then our test positive numbers were relatively high. Okay. On the flip side, whisper low represented a more aggressive threshold from the standpoint that we leave more animals untreated. So at least fictitiously, what this would look like in this example is that we have now reduced the number of animals that we treat, and we've increased the number of animals that we do not treat. Okay. I hope that makes sense. If it doesn't make sense, we can clarify any and all of that during the Q&A session. All these animals were housed on open air dirt floor pens with space recommendations that reflected standard feedlot protocols. All these animals were fed according to the normal site practices. We did allow ionophores, tylosin, and beta agonists, but we did not allow any feed-grade antibiotics. We did measure feed consumption, and water was available at all times, but we did not allow any water medications to be administered throughout the study. Once metaphylaxis was administered, whether that be saline to the negative controls, Suprevo to the positive controls, or plus or minus Suprevo to either whisper managed group, there was a 3-day PMI across all those treatments. Pens were written daily. All the pen writers were blinded to the treatment group. So again, they did not know which animals in any of those pens, which treatment groups they belonged to. Our case definition of bovine respiratory disease consisted of the following: an animal with a clinical illness score of 1 and a temperature of at least 104 degrees, or a clinical illness score of 2 or 3, regardless of that rectal temperature. Okay. Anything with a clinical illness score of 4 was eligible for euthanasia. Our treatment regimen consisted of what you're seeing here on the screen. They were treated up to 3 times. with the first treatment consisting of Res-4 Gold, followed by a 3-day PTI. If they got sick a second time, they received Facial 100, followed by another 3-day PTI. If they got sick a third time, they received Biomycin 200. Okay. Post-enrollment, if those animals did require more than three treatments, they were only removed if there was an animal welfare issue or if they died. Study durations we looked at, depending upon the study site, we looked at one or two different time frames, either at 60 days, which consisted of both one of the Texas sites and the Nebraska site, and then two sites went all the way to close out. That's the second Texas site and the Oklahoma site. And then at study conclusion, regardless of the day of the final day of the study, we collected an individual body weight at that time frame. Outcomes, we looked at health, performance, and carcass metrics. From a health standpoint, we looked at morbidity, second pulse, third pulse, BRD mortality, case fatality, and overall mortality. From a performance standpoint, we looked at average daily gain and feed to gain, both in a deads in and deads out standpoint, as well as dry matter intake. And for the two sites that went to close out, we did capture carcass data on those animals as well. Real briefly on the statistics, an alpha of 0.05 was utilized in the study. Again, like we mentioned earlier, the experimental unit is the pin. We addressed all random effects, and we can talk more about that if necessary. All the statistics were performed by Dr. Dave Renner and Dr. David Amrine at Kansas State University. So jumping into the results, and we're going to go through this. We're going to touch on each site because you're going to see site to site variability, and so I wanted to walk through this site to site. Okay, and I'll do like I said, we're going to throw a lot of data at you, but we did try to lay this out as easily as possible. But again, we can go back and review during the Q&A as needed. So the first site, the first Texas site, we enrolled these animals basically during this time in 2017. Again, these were steers. They were sourced from sale barns in Texas, New Mexico, Florida, and Alabama. Across the board, they average roughly 630 pounds, ranging from 380 to just a tick under 1,000 pounds. The pen sizes in the study was 70 head per pen, with 7 pens per treatment group, and we actually followed these animals only out to 50 days. Okay. So this first table, all of these tables are set up relatively the same depending upon the outcomes, with the outcomes of interest here on the left, the treatment groups here at top, with the negative control, positive control, whisper high, and whisper low group. In this particular case, across all 4 sites, obviously the negative control and the positive control were administered 0 and 100% metaphylaxis respectively. What's going to differ from site to site is the amount administered to either of the whisper managed groups. At this particular site, the whisper high group, we administered metaphylaxis to about 89% of those animals. And in the whisper low group, we administered metaphylaxis to just a tick over 70%. Again, we follow these animals for only 50 days. And at this site, through this 50-day study, we observed that within the BRD morbidity, as well as second treatments, the positive control significantly reduced morbidity in second treatments compared to the negative control. At the same time, both whisper managed groups significantly reduced morbidity and retreatments compared to the negative control. However, both whisper managed groups showed no statistical differences compared to the positive control. We did not see any differences across the board in third treatments or any of the mortality metrics. From a performance standpoint, short-term performance standpoint, throughout this 50-day site, we saw significant effects in average final weight, average daily gain, both in the deads in and deads out fashion, mean day, dry matter intake, and feed to gain on a dead out basis. On all of these, again, the positive control significantly improved all of these metrics compared to the negative control. Likewise, both whisper managed groups showed significant improvement in all of these metrics compared to the negative control, and in all cases showed no difference compared to the positive control. That was the first site. Okay, that site went out to 50 days. Again, write questions down and get as many as we can during the Q&A session. Second Texas site. This site was enrolled from July to August of 2018. These were steers. They came from auction markets in Oklahoma and Alabama, averaging roughly 580 pounds at arrival, but ranging anywhere from 460 to about 960 pounds. This was a smaller pen study. Okay, these were 10 head pens with 20 pens per treatment group, and we followed these animals to close out. Again, these are set up just exactly like we talked about before, with the treatment groups here at top, the outcomes along the left-hand side. At this site, again, obviously negative and positive control showed 0 and 100% metaphylaxis as they were designed. However, at this site, we only administered metaphylaxis to roughly 80% in the whisper high group, and again, roughly 70% in the whisper low group. Again, these animals, at the short-term health standpoint, this was at 60 days. Okay, we did go to closeout, but we had a 60-day time frame here. What we saw at this study was that, like we saw at the first study, the positive control significantly reduced morbidity compared to the negative control, as did both whisper managed groups, significantly reduced morbidity compared to the negative control, but showed no statistical differences compared to the positive control. We saw no other differences in any further morbidity metrics or even the mortality metrics. From a closeout standpoint, again, following these animals to close out, these animals closed out at 233 days on feed. The morbidity differences that we saw at 60 days were able to pull through all the way to closeout. So once again, the positive control significantly reduced morbidity compared to the negative control, as did both of the whisper managed groups, significantly reduced morbidity compared to the negative control, but with no differences in either the whisper managed groups compared to the positive control. And again, like at 60 days, we saw no differences in any of the remaining metrics there. Performance-wise, we saw no difference across the board in any of the closeout performances across the treatment groups, and within the carcass outcomes, we saw no significant differences across the board across all 4 treatment groups. Okay, site 3. This site was located in Oklahoma. It was enrolled in March and July of 2018. These were steers. They flowed through sale barns in Oklahoma, Texas, and Missouri, averaging 615 pounds roughly at the time of arrival, ranging anywhere from roughly 400 to 950 pounds. These were 70 head pens with 7 pens per treatment group, and we followed these animals to close out as well. In this particular study, we administered metaphylactic antibiotics to 87% of the animals in the whisper high group, roughly 63% to those in the whisper low group. At 60 days on feed, we observed significant improvement in morbidity, second treatments and third treatments when comparing the positive control to the negative control. So we saw a significant reduction in morbidity, second treatments and third treatments, comparing those two, as well as seeing the same profile in both of the whisper managed groups compared to the negative control. We saw a significant reduction in morbidity, second treatments and third treatments, with no difference in any of those metrics between the whisper groups compared to the positive control. Again, we saw no differences across the board in the mortality measures. Closeout health. These animals closed out at 240 days on feed. For all intents and purposes, we saw the same profile at closeout from a health standpoint that we saw at 60 days on feed, where the positive control significantly reduced the risk of morbidity, second treatments and third treatments compared to the negative control. Likewise, both whisper managed groups significantly reduced morbidity, second treatment and third treatment risk compared to the negative control, but showed no differences compared to the positive control. And again, showed no differences in the mortality metrics at closeout. From a closeout performance standpoint, these animals closed out at 240 days. What we did see in the study was that the positive control showed a significant improvement of average daily gain based on a dead-to-in estimate. Likewise, the whisper high group showed a significant improvement in average daily gain compared to the negative control, where the whisper low group in this particular setting just missed being statistically significant compared to the negative control. But in either case, both whisper managed groups were no different than the positive control in this particular case. Just missed having a significant effect in dry matter intake. From a carcass standpoint, what we did observe in this particular study is a significant overall effect in hot carcass weight, where both the whisper high group and the positive control showed a significant improvement in hot carcass weight compared to the negative control group. The whisper low group was somewhere in the middle, and so that particular group did not show any differences compared to the negative control, and was also significantly reduced compared to the positive control and the whisper high group. We did not see any further differences in carcass metrics at this particular site. The Nebraska site proved to be interesting, and so every study I've ever done, and maybe it's a reflection of me as a researcher, or and maybe others are better researchers, or that they're able to answer every question cleanly, but there's always new questions that come out of research, and this particular site provided that. We'll get into that here. But at the Nebraska site, we enrolled these animals in the fall of 2018. These were steers procured out of sale barns in Iowa and Missouri. These animals averaged 520 pounds, ranging from 380 to 720 pounds. Again, these were small pens. These were 10-head pens with 10 pens per treatment group, and we followed these animals for 60 days. Okay. So at this site, we administered metaphylactic antibiotics to 82% of animals in the whisper high group and 57% of animals in the whisper low group. Again, we followed these animals to 60 days. However, in contrast to the previous three sites, where at the very least we showed significant improvement in the morbidity estimates, at this particular site, we saw no differences in any of the health estimates across the board. So no difference between the positive control and negative control, no difference in either whisper managed group compared to the negative control. So not only the 60-day health outcomes, but also the 60-day performance outcomes as well. We saw no differences at this particular site. Now, again, I want to remind you all that these were animals that on any other given day would have received metaphylaxis as well. But in this particular case, as you can see, metaphylaxis was not shown to be efficacious in this particular case. But at the same time, we reduced metaphylaxis compared to the positive control by up to 43%. We'll summarize all that in a moment, but I wanted to give you some an overview of the practical application of this technology. For those of you that are familiar with the Whisper Hospital technology, which is the original Whisper technology, it's in the form of the stethoscope. This is not that. That particular form factor, that hardware, as well as that algorithm, is not set up for on arrival processing. Okay, and so we utilize a paddle. We'll talk more about that here in a moment. You can see this individual here accessing or getting exposure to this animal by dropping this lower gate down. As you can imagine, and as you know, every chute is a little bit different, and every chute up till now is not designed with this practice in mind. And so at the end of the day, we have to have some workarounds. The one universal thing that is common to most chutes is that there is a drop-down panel, and we are dropping this panel down about 30 degrees, held in place by industrial-grade bungee cord, and getting access to this animal's thoracic area by means of that. The squeeze can stay on these animals. We're still able to get plenty of breath sounds. Obviously, we're still getting heart sounds, but it allows a relatively easy and straightforward way to get exposure and allow those running the chute to not necessarily change what they're doing. Okay. And so practically speaking, the lung, and so again, just to remind you, this technology is using 4 pieces of information. It's using lung sounds, heart sounds, body weight, and rectal temperature. Okay. The lung sounds and the heart sounds are being automatically imported or collected by the paddle, which we saw in the prior slide. That data is being automatically imported into the app. The user then, in its current form, keys in the animal's body weight and the rectal temperature. If we do not have scales on the chutes, we can use the pay weight and get by that. We lose just a little bit of accuracy, as you can imagine, not much, but just a little bit. And but that allows us to keep moving forward. And again, what the user sees is either a treat or do not treat outcome. So just to summarize all this, first and foremost, this I want to be very clear that BRD control works, and we should not be ashamed for using this practice. But we need to protect this practice. We don't want to lose our ability to utilize this practice. And so Whisper on Arrival, in our minds, represents the next step in evolving that practice to maintaining its attributes, but managing some of the optics around it, as well as just getting more efficient in that process. Across 4 sites, the Whisper on Arrival technology displayed no statistical differences in health and performance compared to a conventional BRD program, which in this case was 100% of Zuprevo used in a conventional manner for metaphylaxis across all 4 of those sites. In 3 of the 4 sites, the first 3 that we saw, both the Whisper on Arrival technology, both of those treatment groups, the Whisper High and the Whisper Low group, significantly improved health and performance outcomes compared to the negative control, again, in 3 of those 4 sites. And in doing so, reduced the BRD control antimicrobial use anywhere from roughly 10 to 43%. Okay. Like I said, there's always new questions that come about, and again, the Nebraska site proved that. There obviously are other factors at play that dictate whether or not you're going to see efficacy in your metaphylaxis program, whether that be antibiotic resistance, whether that be animals that are just, for lack of a better term, programmed to, they are what they are, and there's not much we can do for them when they get there. But all in all, what that tells us is that, there still are gaps. There still are things that need to be firmed up down the road with new technology, or at least new applications to existing technology. Right? And I think based on the, as we talked about earlier, the enrollment criteria reflected animals at medium to high risk. I think based on the, now looking retrospectively at it and the data that's presented, I think it's fair to say these populations all likely reflected a medium to moderate risk population. Just from the standpoint of where it fell. But right now in our beta testing, we are using it on genuine high risk populations and seeing very good outcomes there as well. So just to summarize, across all 4 sites, pins managed with Whisper on arrival displayed no statistical differences in health performance compared to the positive control. This maintained the benefits of a conventional BRD program while reducing antimicrobial use by 10 to 43%. Obviously, this reduction in antibiotic costs, this upfront reduction in costs, is the value to the producer. For us, in our profession, as well as to the consumer, the value is now we have a truly objective means of supporting judicious antimicrobial use. And with that, I believe that's my final slide. Be ready to take any questions. Thank you.
Thank you, Jason. Thank you, Jason, for that presentation. Jason is on the line with us, and so we are ready, and I think he's ready to take any questions that you have. If you have a question, you can 2 ways. You can ask it. You can type it into the chat box if you want to do that. Otherwise, you can unmute yourself and just voice your question to Jason directly. Harold, do you have any questions that you've accumulated?
We don't have any in the chat box at the present time, but I have a question or so for Jason. As we look going forward using this technology, we saw that it reduced the antibiotic usage, but is this going to become more mainstream, do you think, because of the antibiotic issues?
Well, first of all, can you hear me, Harold?
Yes.
Okay, good. Well, I hope it becomes mainstream. But all that being said, that will be determined down the road. Where we're at right now, honestly, in the short term, Harold, where I see the potential challenges is just simply implementing something new into the processing program. I don't see this being mandated by any stretch of the imagination, and I don't think we should ever get to that point. But it's everybody's situation is a little bit different from how the resources they have available, the labor they have available, this, that, and the other, and so those are going to be some of the things that we would see going forward. If I use the dairy industry as an example, we also have developed monitoring technology on the dairy side of the industry, and as of today, roughly somewhere between 15% and 20% of the cows in our U.S. dairies are being monitored by some sort of automated estrus detection system. But at the same time, it's taken us a decade to get there. Okay. Now that was a different time. Again, it's 10 years later. Would we see a greater uptick here? I don't know. But a lot of it's just going to depend, Harold, on how it's in the systems right out of the gate. I think I saw a question come in the chat box there, though, while I was talking.
Yeah. So one of the questions they have is there any possibility or anything in the planning to look at running Whisper versus temp and treat on arrival? So like Whisper now, you've got it set at high and low, but with temp and treat traditionally, it's the calf that's running a temperature, and you would forego the metaphylactic treatment and move right into a treatment drug.
Yeah, and that's a great question. That comes up a lot, and what we need to be clear about, and I want to make sure I'm definitely clear, is that this product is designed not as a diagnosis. So we're not diagnosing animals in the chute. but rather we are predicting if the animal is going to get sick at some point within the next 60 days. And so temp and treat is more of a diagnostic tool where we're saying this animal is sick right now. I'm going to give it antibiotics. If it has a fever above the threshold, we're diagnosing with this. In this particular case, almost over 90% of the animals that the system calls treat, regardless of the threshold, do not have an elevated rectal temperature. Okay, and so again, it's taking all four pieces of that data, and it's predicting, what not necessarily what this animal looks like today, but what's it going to look like in 3 weeks. Okay, so I hope that helps. But answer to your question is right now we don't have anything planned. That being said, compared to temp and treat, if those animals are running a fever and they are sick, we're going to catch them at that time as well.
So one more question. Are we looking at lighter weight calves on arrival prior to going to weeder grass?
Sure could be. The only caution I would throw out to you is that the one thing that we have not taken into account in these algorithms is castration. And so I can't tell you today how castrating that animal, like we just said, this is a prediction of how this animal is going to be in the next, 2, 3, 4, 5 weeks. I can't tell you as it stands today what that castration will do to that prediction. I think we have to assume that it's going to make that the probability that animal is going to get sick, it's going to elevate that prediction. And so what we have done is either in our beta testing, only use it on steers and heifers, or if they are castrating, we wait for them to castrate when those animals come back for revaccination.
All right, so we have one more question. What is the significance of body weight on the function of whisper? So what influence does that have?
Yeah. It seems like about everything we do, the answer is it depends. If there is what we have seen, and it makes sense, lighter animals, we see a greater proportion of lighter animals requiring treatment than not requiring treatment. And so as the lot size gets smaller, as the weight of the lot gets smaller, the need for getting that body weight in there becomes even more important. The system will work without the body weight in there, without the body weight and the temperature. Okay, running with just the paddle and not using the body weight and temperature is very good compared to the full model when those animals are a little bit heavier. When they get down into 400 pounds and less, we begin to start seeing a fair bit of variability. Okay, and so I would urge you that if you're bringing in lighter animals, the need for utilizing all that data becomes even more important.
Then one other question. It said, looks like the possibility of saving metaphylaxis on about 20% of them. How does that 20% versus 100% work out as far as economically and the cost of whisper put in there?
Yeah. So in the studies, it ranged anywhere from 10 to 43, I think it was. And in our beta testing, we've been able to reduce it even more than that. And so all that depends on the kind of cattle that you have, as well as the threshold that you set the system at. And that threshold setting really is based on the risk tolerance of the user. But as an example, let's say we were able to reduce it, by 20% as the example. Okay, 20% honestly is going to be it's going to be pushing that break-even point, frankly. And so let's assume a drug costs $20 as an example. 20% is going to be $4, right? And so, this test is going to be somewhere around $2 a head. So then you've made $2. Okay, you're $2 a head. whether or not $2 justifies it or not, it's hard to say. And so there again, that's where the discussion from person to person is important as far as where do we want to set that threshold? What drug are you using? What's the cost of your drug? What threshold are you comfortable with? And what kind of capital do you think you're going to be bringing in? So.
All right. Thank you, Jason. I think we're right at the 5 o'clock hour. So, Bill, are we ready to start the next one?
Well, we are, but is there anybody out there that has a question that they want to voice? If you do, you can unmute and just speak into your microphone. So I'll give people a moment, but Jason, I was curious. So do we have the ability to? I guess we have the ability to select whether we're high or low, and we might be high on one group and low on the next, right? I mean, so we can adjust this threshold on the fly.
Yeah. But ultimately, that's where it stands. We right out of the gate, we have taken that functionality out of the system to where the user can't actually toggle back and forth. We wanted to avoid crises from occurring where you go low on one where you wanted to go high and vice versa. But within about 5 to 10 minutes, we can make that flip. Just a call to our help desk. And we can make that conversion online and get you set up in a matter of minutes to be able to do that.
Okay. All right. Very good.
What about user variation, Jason?
Yes, there definitely can be, and it's not so much the user, Harold, as it is the chute. As I mentioned there in that presentation, there is a lot. These chutes were not designed for this application, admittedly, and that being said, we can generally get it set up to where we don't have to change the way that the guy using the chute is processing animals. At the end of the day. What is probably ideal in lieu of somebody buying a new chute with a door that opens right up is creating a window in that chute. That's not something that I like to jump to because that means having to modify your chute. But that's something that we can do, and that does take away a large amount of variability. You may see from person to person. There still is some some used to, but honestly, it doesn't very many, Harold. And also compared to the hospital system, this form factor is set up to where there's a lot more wiggle room, if you will, in terms of not necessarily having to be in the same spot on every animal. You've got a little bit more room for error there.
One last question. It's time. How long does it take to gather the information for the machine and put out the
Yep. And so the time component is always going to be front of mind, just from a labor perspective, from a cattle handling perspective. When we're using all of the information, admittedly, taking the rectal temperature is the rate limiting step. And so where we have had users really push back on that, what we have done, like I mentioned earlier, this technology will perform with just paddles, so just using the lung and the heart sounds, okay, and forego body weight and temperature. And so just by using the paddle and not hand entering in weight and temperature cuts a significant amount of time off. What the example that I would use at one site is that at first they were using all the data, so they would use the paddle and then type in rectal temperature and body weight. And the folks processing the animal would be waiting on the person using the whisper on arrival system. Once we switched them to just using the paddle, then it flipped. The person using the whisper system was then waiting on the folks processing the animal to get done. We do lose a little bit of accuracy by doing that, as you can imagine, especially as those animals get a little bit lighter, but we carve off a tremendous amount of time. And so, again, that is part of the discussion is, are we willing to risk, perhaps misclassifying a handful of animals for, gaining a fair bit of time there.
Any more questions? Thank you, Jason. Now I'll turn it back over to you, Bill.
Okay, well, thank you. Well, if anybody has any questions emerge, just type them in the chat box or contact us. We can get Jason to answer them. We know where he lives, so we can get him to answer them. I'm going to move next, and so today's kind of theme, if you will, is health monitoring and technology. And I guess that's really appropriate given that we're doing this by technology. And I want to report that there are 131 listeners right now. That's really great.